Welcome to video lecture number 3 for chapter 11. In this video lecture, we are going to cover disorders of the white blood cells. To begin, we are first going to take a look at a form of testing called DIF, which stands for differential white blood cell count. Okay? And what this is it's a test that provides a list of the percentages of all of the various types of white blood cells in a given blood sample. And like I mentioned in prior videos, there are different types of white blood cells, which I'm not going to talk about just because I don't think it's as important. But if you want to learn about them, they are in your textbook. But depending on which types of white blood cells have elevated levels, the doctor can narrow it down to exactly what is happening within your body to very specific diseases. Okay, and we're going to get into some possible disorders that are related to the different white blood cells, but let me first remind you that the term for white blood cell is leukocyte. And remember, the root leuko means white, and the root or suffix cyte means cell. So just keep that in mind. So the first disorder of white blood cells we are going to take a look at is leukocytosis. Notice the leukocyte in there, so you know that this has something to do with white blood cells. Leukocytosis is a general term for having an excessive number of white blood cells. So like I mentioned a few seconds ago, depending on the type of white blood cell that is elevated, it can determine the diagnosis or at least help your doctor get closer to diagnosing you. Now remember, I'm not going to cover the various types. So when I mention them, if you want to know more about them, you can look in your textbook or online. I'm just not going to cover it. So an increase in neutrophils, which are the most common type of white blood cell, means that you have some sort of an infection within your body. So that's a more generic one. If you have an increased level of eosinophils, that means that there is some sort of an allergic reaction taking place. Okay? If you have an increased level of monocytes, which are the largest of the white blood cells, that means either the patient has, it can be kind of diluted down into either typhoid fever, malaria, or tuberculosis. Okay, so those three are kind of related to an increased number of monocytes. And an increased level of lymphocytes, which are the smallest of the white blood cells, is related to whooping cough and other diseases. Okay, so again, this is showing you how an increase in a certain type of white blood cell can help the doctor kind of narrow it down to what you might have. Leukemia, which is a term that you've probably heard before, is cancer of the white blood cells. So leukemia causes a really high increase in the production of leukocytes. So your bone marrow is going to be making all sorts of these white blood cells. And the high numbers are going to just completely take over the bone marrow, which leads then to a deficiency in red blood cells and platelets throughout your body. So if you look at the picture in your slide, right, the normal blood is mostly red blood cells with some white blood cells inside. But with leukemia, your bone marrow is just making tons and tons of white blood cells. So there's not enough bone marrow to make your red blood cells, which leads to the deficiency in red blood cells along with platelets. Okay, so that's leukemia. The next disorder of white blood cells is leukopenia. The root leuko, again, you know, means white, and the suffix penia means deficiency. So leukopenia means a deficient number of white blood cells. Now remember that white blood cells are in charge of your immune system. They help you to fight off infectious agents like viruses and bacteria. So leukopenia usually occurs when you have some sort of a viral infection, like if you have measles, mumps, chickenpox, polio, AIDS. Those lead to a compromised immune system because you have a deficient number of white blood cells. So that's the reason why this leukopenia is the reason why patients with these viral infections, as well as patients that are undergoing chemotherapy for cancer treatment, it's why they cannot get sick, because their immune system is so compromised, either due to fighting off the viral infection or undergoing that chemo, that even getting a mild infection can lead to death because they just don't have the defense. Okay, so that's leukopenia. And the last disorder we're going to talk about is pancytopenia. If we break this word down, the suffix penia means deficient. The prefix pan means all, and the root cyto means cell. So pancytopenia is the deficiency of all of the blood cells, which means that they are going to be deficient in red blood cells, white blood cells, and platelets all at the same time. And this is what happens when an individual is undergoing chemo, okay? So again, if someone is undergoing chemo for cancer treatment, there's a lot of guards that are down due to the chemo just attacking everything, and it's why they can't get sick, okay? So that's kind of during this time, right? There's a lot of families with people who have cancer, who are going through chemotherapy, who even just leaving the house, they're risking their lives, because if they were to get even just a little bit sick, they could die due to the deficiency in their blood. Okay, so that is going to do it for video lecture number 3.